Welcome back, my Copilot. This time we are going for third mission and we are going to see some things that can be improved. Some points that we will see that will happen again and some things that hopefully we won't see again. But some of the mistakes are recurrent. Let's take a look. First I will show the two clips because this was at first an unsuccessful intubation attempt, and then we got the tube in, but we'll see that what happened. So let's first just see, and you can see that okay, I'm getting in pretty okay, but again, where's the suction? No suction is an issue. We'll see that a few other times in the next videos. So yeah, something to improve. And here I'm struggling to get the tube in. Soon we will talk about what happened and why is this happening. And I decided to stop, let's beg and let's try again later. We'll go change our strategy. I was trying with the guide wire, now let's try to use the bougie. There's a lot of evidence that bougies are better, and let's see how we go. So I'm going step by step, trying to find the view I want, and yeah, that's not what I wanted to see. What's happening here we'll discuss soon, but okay, we are struggling a little bit. What can we do better? Why is this not working? Yeah, we're struggling a little bit, and I think we are in, maybe, not sure. I've just seen the bougie. Yeah, let's get a little bit further in, and I think we are in. Yeah, okay, seems better, right? Okay, so we struggled a little bit, but now we are in. We can pass our tube over the bougie and get the patient venting. So yeah, let's see. There we go. The tube is in and the video is out. Okay, let's see what went right and what went wrong. Let's go from the beginning. So here we are, and we have us to start with a soiled airway. The patient was regurgitating. So where's the aspiration? It would help. Yeah, I'm quite sure this would help. But okay, the view, I'm almost midline. I'm going step by step. Okay, we are engaging the ligament. We are opening the trachea. We can see the epiglottis. We can see the arytenoids, and we can see the vocal folds. So this is pretty good. Sorry about this. And okay, let's go. The tube is trying to go to the place, and computer is acting up. I have the tube in the inlet, but it's not going in. Why? We have seen this issue in another video, right? In our second video, I guess, the last one. And the problem is that the way the wire is mounted, it's a kind of a hockey stick, and the angle I'm putting my force in is pushing it this way instead of this way. That's I want to go inside the trachea, not to the back of the patient. So this is an issue. What can we do? We can get the wire a little bit back, and hopefully it will go in the right place. So it's one way to, or maybe we can change the angle of our guide wire. So it's two things we can do, but we can see that we are struggling because the way the force is being applied on the tube, it's not going to the right place. So this is the first issue, or maybe the second issue we are having here. And another thing, you can see that because of the airway as it was soiled, when I'm getting my tube out to bag the patient, uh, it hits the optic, and now I have a soiled optic also. So I'll have to clean up before the next attempt. So it was, yeah, not the best. One could argue correctly that it would be better to just get a LM and bag the patient. This is a bit of an maybe an ethical issue, but this patient, we didn't think the patient would make out, so wouldn't have ROSC. So yeah, I decided that probably insisting a little bit on the intubation wouldn't be so bad for the patient. We wouldn't change the outcomes. So I decided to try and intubate again. Also, one thing that happened in this case is that I started to get a little bit confident with the video, because when it's easy, it's really easy. And I didn't position myself and the patient in the right way. So this is another issue that we had here. Getting the best positioning of the patient will help a lot on your intubation attempts. So let's see the second clip, what we have done right or wrong. So here I was like, yeah, I can't go straight forward because I have a soiled airway. I'm going to soil my optic, so let's go a little bit slower. So I went trying to get that suboptimal vision, and we are going, and I was like, yeah, that's kind of what I want to see, right? Let's see what I want to see. I have the epiglottis, I have the arytenoids, and I have a little bit of my trachea. So this should be enough. It's on the top of my screen. But what I want to see, you to see that how far we are. Here is the ligament. Here is the ligament I want to engage. So I have all this distance from the ligament. This is not great. We can improve that, right? So, okay, we go a little bit forward. We can see the ligament even better. And, well, what happened? The way the bougie is entering, it's passing in front of the optic, and the light source is striking the bougie, and the auto white balance is making everything else darker. So I can see just my bougie, I didn't see anything else. There are a few ways to mitigate this. One is to try to avoid the bougie passing right in front of your optic and light source, sometimes coming like a bit more from down the downside, like from here, yeah, here, or sometimes a little bit more from the side. There are a few other videos on the internet. I think Cliff Reed has one that explains this and some ways to get better with the bougie, but try to avoid passing in front of your optic. So yeah, this is an issue. And you can see, let's see if we can, here, one thing we can see, if I get my screen and split it, let's see, it would be pretty much here. Everything is on this side. So that means my blade is angled that way. So when my bougie is coming this way, it's passing in front of my light source. And that's why it's blocking the path, and it's complicating my life. So be careful with that. If I had the blade more straightforward, more midline, probably this would be easier. I wouldn't have my light source shining on the bougie, and it would be shining on the back of the throat of the patient, that's what I want to see, right? So let's see if we can see if there's more teaching points on this video. It's buffering. Maybe I should get a new computer. Okay, I can't see anything. Yeah, I'm struggling a little bit. And what I decided to do is to get the bougie out, I think, and go a little bit further with my video. Let's see if that, yeah, bougie's out. And see, I go a little bit more to the front, and how I engage the ligament and how it will pop. Yeah, I'm still a little bit far off, but when I went to the front, the ligament popped, engaged, popped my view, and I retracted to a suboptimal view again. But just this little bit more to the front made a lot of difference in our view, and now the bougie is in the right place. And I can see here, still not the best, but let's see if we can show what we are seeing here. Yeah, I'm struggling a little bit here. Let's see. Yeah, so here I have the epiglottis. I can see a little bit of the arytenoids, so I know I'm in the right place. But again, you can see that everything is on this side of the screen. So this is not ideal, right? The way my blade is angled and my bougie, they are crossing the paths, and the light is shining here instead of shining there in the back. So that's an issue. That's what we are trying to correct. Let's see. I think that's pretty much it. After that, yeah, we can see that it's in the right place, and we are just waiting for the tube to pass over the bougie. Yes, some things there, we can see that there are a lot of, and now again, the way it's angled, can I be sure that the bougie is in the right place? Yeah, the bougie was, but the tube, I want my cuff inside after the vocal cords. Can I see it? Can I be sure? Yeah, not really. So this is not ideal, right? I wanted to get a better view and see if where my cuff is. So I can't really see the markings anymore. I can't see the cuff there. So that was a little bit of an issue. So yeah, there's a lot to get better, right? Our learning curve is progressing. We tried a new technique. We were trying to use the stylet. Now we are moving for the bougie. So it's again, we are in a new learning curve. So let's see. I'll wait you on the next missions to see how we go, what can we improve, and what we can do better, and what we are doing better already in the next missions. See you, my intubation copilot.